Hello everyone. In this video we will study about surface marking of carotid arteries. In this image you can see this is common carotid artery. At the C4 vertebral level, this common carotid artery divides into two parts, external carotid artery and internal carotid artery. For surface marking of carotid arteries, we will mark 4 points. For first point, you need to palpate clavicle bone and move your finger towards medial end of clavicle. Near the medial end of clavicle, you can easily palpate sternoclavicular joint. Mark this joint as our first point. For second point, you need to palpate C4 vertebra. To palpate C4 vertebra, place your two thumbs below the base of neck at the median plane and sliding up your thumbs. When you reach the base of neck, you will feel a prominent spine. This is spine of C7 vertebra. Now move your thumbs up and count for the vertebrae like C6, C5 and C4. Make a horizontal line from upper border of C4 vertebra. In this image, this is the level of upper border of C4 vertebra, and this is the prominence of sternocleidomastoid muscle. So you can mark second point on anterior border of sternocleidomastoid muscle at the level of upper border of C4 vertebra. For third point, you need to palpate mastoid process just behind the external auditory meatus. In this image, prominence of mastoid process is covered by external ear. Here you can see this is the angle of mandible. Make a line between tip of mastoid process and angle of mandible. And the midpoint of this line is our third point. For fourth point, you need to palpate angle of mandible and move your fingers upward. When you reach anterior to tragus of ear, you will feel a prominent condyle of mandible. Mark the posterior border of condyle of mandible as our fourth point. When you connect first and second point with help of a double line, this line will represent common carotid artery. When you connect second and third point with help of double wavy line, it will represent external carotid artery. When you connect second and fourth point by a double line, it will represent internal carotid artery. Thanks for watching.